everybody, I'm Dr. Willardsen. Sorry, we're coming in a little late this morning. And got a great live view today. We would like to go over some different cases, scenarios, and talk about some of the issues and answer some of the questions that we're getting from our channel. Patients who are inquiring about certain things. But the first thing I'd like to talk about is, you know, on YouTube, there's all different ideas, concepts, opinions, of course, and something I came across over the last little bit is, can I have the mouse? So here, there's a video of a doctor who is, promoting, how, why to avoid dental implants. What are reasons that you should avoid them? I mean, his whole view is that you should avoid them at all costs. And I haven't watched the whole video. I watched a portion of it, and that was enough for me. But, in our practice, and if somebody is really involved in implant surgery and the prosthetics and restoring the lives of patients, they wouldn't create this sort of content, because we see it on a daily basis, the transformative, life-changing, and again, I say it all the time, but every time we deliver a case for somebody who's lost all their teeth or due to whatever cause, whether it's gum disease or just breakdown in the mouth, a lot of times it's fear of the dentist. They're afraid to go to the dentist, and so they've neglected or they've just not taken care of things. So, for those patients who are in that situation, and there's a lot of them out there, there's a lot of patients that are out there, and we see it here in the practice all the time.
Yeah.
Memo is constantly interacting with, communicating with via email or responding to questions on YouTube or on television. And we see these patients all the time that have mouths that are completely broken down. So if we were to follow the advice of this doctor who says avoid dental implants at all costs, your options are, for those patients who are losing or have lost their teeth, your options are, you have one option, and that's dentures. And, dentures are just not something that I would ever want to put. In fact, I haven't done a complete denture, and other than if it's a temporary, a means to getting to the final fixed permanent bridge. I mean, I can't even tell you. I think it was dental school was the last time I actually did a denture on a patient that I knew that was the definitive final restoration. Like, they were not getting anything else. It was, I literally think it was in dental school. So, and I won't tell you when that was, because it was a long time ago. But, so I don't get why somebody would create content and everybody has their opinion, and I get it and I respect that. But for those patients who are in that situation where they've lost all their teeth, or they're losing their teeth, and they want to get back to some sense of normalcy, the only way to do that is through dental implants. And so, I just kind of wanted to put this up there, because as patients or people kind of scour the internet, and they always somehow find YouTube as a source of education and a source of information, which it is a great source, but you're also getting a lot of fake news on there and a lot of information that's just not true. So now, if it can be catastrophic, like our last week live view when we were talking about some of the scenarios, and we'll look at some again today where patients have spent money and it didn't work out very well for them. And so they, so it's important that you end up in the right place and you have good materials, and good surgical and prosthodontics techniques. And if that's the case, you're going to love having your mouth restored, restore confidence, restore your smile, restore mastication, or the ability to chew and eat. And so...
So, doctor, question.
Yeah.
I haven't watched this video yet. What were some of the reasons that he was giving?
A lot of the reasons were, because he doesn't do implants, and so he's offering options that he knows how to do. If you're missing a tooth, just get a bridge. Shave down the 2 adjacent teeth and then put a bridge there, or get a partial. A partial comes in and out. In my practice, I've seen it over and over. Patients that have come to me as a consultation or that are wearing partials, generally the adjacent teeth that are holding the partial are loose because it acts as a fulcrum. It actually kind of extracts the tooth itself. So, when I look at in a bridge, same thing. You shave those teeth down. It's a matter of time before you're going to lose those supporting teeth or the abutments supporting the bridge. And then it's this domino effect. So you have to, 1, you lose the bridge, and then 2, you're moving on to the next tooth if you're going to do a bridge again. And now this domino effect continues. We showed a case last week where the patient had gone to Mexico, had a bridge from his canine to his canine, and the bridge had fractured after about a year, and so the canines were compromised. So now we're moving back. So you go from a 6-tooth bridge to an 8-tooth bridge, which that sort of mechanics doesn't work. The cantilever on the front of the bridge just doesn't work. So, my head is spinning because there's just so many variables. Whereas with implants, like that same case from last week where he had that bridge in the front, if I just put implants in the lateral positions, I've now broken that bridge up into a fraction of what it was when he came in, and the support is a lot stronger. So
we have a question over there from Christina, yeah. So cigarettes. That's a great question. So let's talk about smoking, which is a little bit off of our plan here, but it's a great question. I want to address it. If you were to have a hip replacement, a knee replacement, any sort of orthopedic replacement, even if you had like an implant you had to put in your heart, the surgeon the surgeon would be very adamant about no smoking, and that is an indirect effect. So the smoke affects it's basically the nicotine and the carbon monoxide is going into the bloodstream. So it's an indirect effect on the implant or the surgical site. So even if you were to have a plastic surgery, facelift, blepharoplasty, nose job, surgeons are going to be adamant about no smoking. Dental implants magnify that about 10 times, because when you have your teeth pulled or whatever the case may be, have a bone graft done, implants placed, and then all that hard work is done. Doctor sutures the tissues closed, puts membranes in and grafting and implants. The smoke directly affects the surgical site. Unlike a knee or a hip, it's an indirect effect. So you're getting both a direct effect to the surgical site. The smoke is going directly to that area, causes dry mouth, binds oxygen. So the carbon monoxide in smoke will bind oxygen to create carbon dioxide that steals that oxygen molecule and delays the healing process. So there is what we call a smoking cessation protocol. It's kind of an old protocol. I would rather just, if a patient's going to go through this sort of work, make the investment in time, effort, and money, have a fresh start. If you can stop smoking, try using even a vape, I think, is better than smoke itself or cigarettes. Use a patch. But to answer your question, smoking has a direct effect on the surgical site in the mouth when you're having dental implants. And so it is very important to not smoke. The smoking cessation protocol is no smoking for 2 months, pre-op or before surgery, have the surgery, and no smoking for 2 months after surgery. And then they say you can
smoke again. But in my practice, if you can go 4 months no smoking, then I say just quit. But that's easy for me to say. I've never had that issue. So hopefully that answers your question, Christina. But this is too important of a procedure to compromise the the healing. You want this to heal perfectly. You want there to be no issues there. You want a surgeon that's going to place the best implants in the best position and give you the very best materials in the final restoration so that this will last you the rest of your life. Because if you're having issues or self-conscious about your smile, this can all be solved. We can fix this, no problem. And it's a lifelong procedure that you can count on, but it has to be maintained, and ideally, no smoking. All right. Hopefully that answers your question.
I think it did. She said, "Thank you, doctor."
Oh, good. Awesome. All right. So enough of this. So avoid dental implants. No. If you're losing your teeth, have failing teeth or indentures, or are just miserable, do not avoid dental implants. There is no reason for it. It's a wonderful procedure, very predictable. And in the end, if somebody's promoting to avoid implants, they've probably had bad experiences with them because maybe they themselves have tried to place them and had failures, or they've referred out and had some issues that way, or maybe they don't know how to restore it. It's hard to say, but I'm not sure exactly why you would put something out there stating to avoid something that is truly a transformative, life-changing procedure. And we should be grateful for the fact that we have it. Like I've talked about my grandma in the past, and she had dentures and lived with them, suffered with them, never was given the option for implants because they didn't really exist at the time. And, she managed okay, but I can tell you that she would have been a lot happier if she would have been able to have implants to hold her fixed prosthetics in her mouth. Okay.
That one's a pretty good question.
Okay, Christina is asking, I'm 25 and have about 4 teeth gone. No, there is no age limit. She asks, is there an age limit for getting dental implants? And definitely not. There is, I take that back. If the growth plates for females, I'm comfortable placing implants in a certain type of scenario. For example, a lot of times patients are missing congenitally, so they're born without their lateral incisors on the top. And so the youngest case I've done is a 14-year-old female that had congenitally missing laterals. She was just missing her 2 laterals or 2 teeth. She had been through ortho. The teeth were in a stable position. And so I was able to place those implants. Actually, she was almost 15. She was 14 and just shy of 15. And so we were able to place implants and restore her case, no issues. So, and now I believe she's 25. So, as a rule, we want to place implants, especially a full mouth of implants. I doubt you'll find an 18-year-old who's losing all of her teeth or have lost all of her teeth, but there are scenarios where you've got congenitally missing teeth. I did a case, a young man who was about 18 at the time. Had to do a lot of grafting and regeneration of the bone, but we rebuilt his whole mouth with implants, and we saved some of his teeth. So again, it was a very customized plan according to his needs, taking into consideration his age and the autoimmune disease that he had that he caused him to have congenitally missing dentition that we were able to replace with dental implants. And now he's probably in late 20s and happy guy, good guy. In fact, he's applying to dental school. So, and it was because he had been through so much and he felt how great it was to have his mouth restored after having suffered, going all through high school. He had a flipper, something that comes in and out all through high school. He had these teeth that came in and out, and he would tell me how self-conscious he was with that. And so, anyways, back to the question of what's the age limit. It varies per case. What type of case are we doing? If it's just one tooth, I'd say the youngest would be 14, 15 females. For a male, I'd say in that same scenario would be 17 or 18.
What about a full mouth? What's the youngest?
A full mouth case, the youngest case I did was this young man I was talking about. But it wasn't a full mouth of implants. He did get 10 implants, just replacing teeth that were missing, and then we restored because he has a condition, was amelogenesis imperfecta. So the teeth themselves were kind of not in the greatest shape, just because they were defective how they developed. And then with that, he was missing quite a few teeth. So we fixed the natural teeth with crowns and then put implants in where the patient was missing the teeth. So, and like I said, at the time he was about 18 years old.
Okay.
Yeah. So it's case dependent, patient specific, and we would make that call as we see the patient. So
would you say that 25? That's a pretty good age for someone who's missing, like?
Yeah, I mean, even 20, 21 at that stage, the craniofacial growth is stopped. It's going to change a little as we get older. Our nose gets bigger and our ears get bigger, but the maxillofacial region has stopped growing.
Okay.
And the other beauty of it is, like, this 14-year-old female, even though her face wasn't fully developed and grown yet, but because she had ortho and braces, it had stabilized the teeth, and so it allowed me to place the implant. And because the teeth are stable, they're not going to move much out of that position because the bite is so strong, and it helps support the the stability of the mouth. So by having that implant in there, it just kind of helped stabilize everything. Now, had I not put it in, it creates this area of movement that space can close. So to me, it's important to get in there, maintain the space, especially after they've had braces or ortho, so that long term they can have a solid foundation. And again, I go back to the biomechanics and how it works, how it functions. If every time you bite down, again, it's 450 pounds per square inch. So if the patient's biting like that, it's going to maintain the position of those teeth. So anyway, it's kind of a long, drawn-out answer for a simple question. So, all right. And then let's see. We got another question here from Mimi. Do you recommend having all teeth removed prior to seeing you for implants? Another great question. And I would say no. If you're considering having dental implants, the process is very specific. So the extractions, because I get this question all the time. Should I go see my local oral surgeon or general dentist and have the teeth pulled and then come in for implants? My preference would be to do the whole case. Implant or extractions and the surgical phase of extractions is very important. For example, you have all this bone on the front of the jaw, top and bottom, and oftentimes when they do an extraction, they'll grab the tooth and they'll kind of rotate it forward and back and side to side, and sometimes they'll break the buccal plate or the plate of bone that's here in the front, or sometimes if it's a difficult extraction, they'll remove a large portion of bone. And if you're having or considering dental implants, bone is key. So we call it atraumatic extractions. We want to do as little trauma to the bone and tissues when we're extracting the teeth as possible, because we need that bone for a good end result for the implant surgery. So in my hands or in my practice, my preference would be that I do the extractions, because then I have control over that process. And then also the degranulation of the infected tissue underneath. A lot of times when you pull a tooth, oftentimes the tooth is pulled, the doctor just sends the patient out the door. And if you don't degranulate or clean up the infections. So you have a tooth, and at the tip of the root, there's a ball of infection. And sometimes if you pull the tooth out and that infectious tissue is left at the apex or at the bottom of the bone where the root was at, or oftentimes they'll break a root tip off. And so if you leave that there, the body will break it down, but it's best to remove all infection, make sure there's no root tips left, and then build that bone back up, fill the hole back up, put a membrane over it, and then stitch the gums closed. So it's a lot of extra work, even just one tooth or one extraction. It's extra work, but it helps to maintain and ensure that down the road you have sufficient bone for implants, a nice ridge to work with. So there's a lot of variables that a lot of times you don't even think of unless someone tells you, do these steps, so that in the end, because once that tooth is gone, it's gone. The only way to replace it is with an implant, or like this other guy says, a bridge. Obviously, you'd prefer to do the implant because you don't want to destroy the adjacent teeth. So, or if you're extracting all the teeth, very important to make sure that every single site, so let's say I'm extracting 10 teeth, I have to go into each site very methodically and remove any granulation tissue or the pus, little pus pockets that could be left behind. And I also clean up what's called the periodontal ligaments, so the fibrous tissue that are connected to the bone. I want it to be solid bone, and that's it. And so once I have that, and a lot of times the contours are kind of all over the place, so I need to level off the contours. The body does not like uneven surfaces, so I'll clean out, degranulate, make sure the contours are nice and even, build the bone or the graft up to the level of the top of the ridge, and then put a membrane over that, and then I stitch the whole thing closed so that, and if that's done, that graft will heal, the bone will heal, and it will be an ideal site for placement of implants. So
that's awesome. I like how, you mentioned it's a long answer, but I like that because you're really diving into everything that you're doing. It's not extracting it and then stitching it up and doing all, and then leaving it. Like, there's things that you can do for it to
help the process.
Go a lot smoother.
Right.
Christina kind of had the same question, but you answered it with.
Yeah, so Christina asks, my dentist is telling me to get the teeth pulled that have broken off at the gum. 4 teeth I was talking about. If I get them pulled, my jaw bone will decay. In theory, if you're Christina, if you're planning on having implants, and if those teeth are not like infectious, meaning you've got like pus pockets or fistulas, or I don't know, if I would get them out as soon as possible, but make sure whoever takes them out knows what they're doing and is doing exactly what I just said. Degranulation of the extraction site, removing the pus pockets that are at the tip of the root or the apex of the root. Really clean that area out. I clean it out, I degranulate it, I irrigate it with antibiotics, doxycycline, and then I'll graft and fill the hole with bone, and then put a membrane over the top of that to separate the bone tissue from the gum tissue, and then suture that closed. So it's quite a process. It's not just a matter of pulling the teeth out. It's a very delicate procedure that has to be handled properly, so that in the end, if you're considering dental implants, you've kind of helped yourself get the very best result possible. And so with that being said, I would probably not follow the advice of your general dentist in that just have the teeth pulled and then get implants later. I would consider right now your mouth is, you want implants, then do everything you can to make sure that you have success with those implants. And that would be, and the extraction is, the removal of the teeth is the first step in that process. And going with somebody that knows how to manage that is real important. I mean, there's oftentimes, even, for example, when we extract third molars or wisdom teeth, 99.9% of the time, a doctor will remove those teeth and not even put a suture over that hole. So you pull the tooth out, there's a hole left. And here I extract the tooth, even on a wisdom tooth. So all the other teeth are fine. Wisdom teeth come out, that's pretty typical and standard protocol. You take the wisdom teeth out and I will graft those sites. I'll put a membrane in and I'll suture them. So now many will say that's overkill, but you have a very thin wall of bone right up against, so let's say tooth number 1, which is a wisdom tooth, tooth number 2 is right next to it. When I pull out tooth number 1, there's a big void. And so this wall of bone around tooth number 2 could potentially be compromised by the healing process if I don't backfill that hole and clean up the granulation tissue, backfill it with bone, and then suture it closed. If I do that, I know that I'm going to protect tooth number 2. So that's the reason for, in my practice, extracting even wisdom teeth, which most people would never consider grafting. I do because I want to do everything I can to help maximize the long-term benefits for the patient.
And I would assume that, let's say someone gets their extractions done somewhere else and then they go to a different place to get dental implants, it's going to be a lot easier and the process is going to be a lot smoother for the next doctor.
Right.
And then probably even like charge less. Because
yeah, that's a great point. Also, I have no idea if the doctor is grafting. I don't know what type of material he's using. So, and the graft material in my hands is critically important. The type of graft material that I use, I've been using for 20 plus years. I know what to expect when I go back into that site and I go to place an implant. I know exactly what to expect, and so I don't question what I'm going to find when I go back into a site that I've prepared. Now, I've had cases that have come back to me where the doctor has placed a graft, and a lot of times they're using anything but an allograft or an autograft, and I just find this jumbled granulation of material that I end up having to remove. So now I'm moving backwards because the type of material used for the bone graft was not correct. So, again, whoever you're going to have do your implant surgery, have them take out the teeth. They should have their own protocol. They can, if they've been doing it long enough, they're going to want to build the bone and the tissue that's going to support these implants the very best way possible, because they're as invested as the patient is in the sense of they want this case to work.
Yeah.
And so, yeah, really important. So now Mimi asks, I had extractions done in the 90s. So patients who've had extractions done many years ago, that bone is healed, and it's just a matter of the quantity and quality of bone, so that so grafting isn't necessarily, unless of course we're having to graft the sinuses or do something to help generate or create more bone. Because oftentimes if you lost your teeth in the 90s, a lot of times that bone resorbs. It over time it does shrink because there's no more stimulation to the bone. We talked about in a couple of our other podcasts that the bone is no longer stimulated because the teeth are removed, and as a result it starts to shrink back. And as it shrinks, then in order to put implants in, we need to do some pretty it's not heroic, but we've got to do extensive grafting to help regenerate that bone to get it back to where I can put in implants to support a fixed set of teeth. So, all right. So moving on. A lot of the questions we get on our channel are based around the cost. And this is a bit of a sensitive subject because it's an expensive procedure, kind of no matter how you slice it. And you'll see prices all across the board. I mean, we've seen patients come in that they've been quoted $20,000 for a full mouth reconstruction. It's usually like an all-on-4 type case, upper and lower all-on-4. And at that price, it's most likely a guy that just wants to learn how to do it, and he needs to cover his costs. But be very cautious of that. oftentimes patients will go out of the country and have it done. We'll show some, and we talked about this or touched on it last week a little bit, but there's something said about paying. You get what you pay for. Sounds cliche, but it's true. Let's take a look at, let's kind of consider this like a car, and I hate to use that analogy, but in reality, it's true. So let's see here. I'm gonna transition. Okay, there we go. All right. So if we were to look at a new Porsche Cayenne, really nice car, the base model is $79,200, which is a lot of money. That's a lot of money. But that's just the base model. So it probably has maybe a V6. Interior's probably decent. It probably has a good, decent stereo. It'll definitely get you from A to B, and you'll feel good about it, and you'll be driving this nice, beautiful car. So that's $79,200. The brakes probably aren't the very best. They're probably decent, but they're not the very best. The engine probably does not have the same power as the top of the line, because let's look at the top of the line Porsche. So the base model Porsche Cayenne is $79,200, and I got to move us. How do I move us, Dennis, so I can see this?
From that screen, I think. The other screen.
Oh, the other screen?
Mm-hmm. No, Dennis, we need to move the screen.
This here. Anyways, so the top of the line Cayenne, and we're having some technical difficulties here as we're trying to figure out this software, which is, I think we need a different software.
The video of us needs to go smaller so we can show the car. Do you know what I mean?
Let's see here. And
Can show. Now, where you can just talk about the price, it kind of shows they're all the same on the images.
Yeah, I know.
Literally, huh?
Okay, well, anyways, sorry for that little technical difficulties here. But the top of the line Porsche Cayenne Turbo GT is about $220,000. So what's the difference? You've got the base model at $79,200. It's the same, basically the same body. It's the same. Oh, there we go. Now we can see it. So it's the same body, and there we go. All right. So the Cayenne Coupe base model is, I guess, $84,300. These are the different variations down to the top of the line Turbo GT, $196,300. So the only reason I wanted to show this is because as patients get consultations or they're in need of dental implants, they will tend to, I don't even know how many, we'll see a consult, and last week I saw a guy, he's been to like 13 different doctors, so 13 offices. I can't imagine the amount of time he spent going back and forth to different offices, and got fees everywhere from about $40,000 to $120,000. And so, where is the $40,000 case? What exactly does that mean? And where is the $120,000 case? What exactly does that mean? So what I'd like to do today is go through some photos and talk about what is involved in the fabrication or the completion of a case that that we can count on, that we can 5, 10, 15, 20, 30 years down the road, when I see this patient, I can shake his hand and say, great job, looks good, it's healing great or maintained well. It's part on the patient because I have to maintain it. But what is the difference, because we also see cases that have spent $50,000, $60,000 and a year and a half later, things have broken or fallen apart. Imagine if you bought this Porsche Cayenne Turbo GT for $196,300, and then a year and a half later, the transmission goes out, blows a motor, who knows? Fortunately, you have insurance to cover that, or at least there's probably a warranty somewhere. But, stuff happens, life happens, things can happen, but if you can build a foundation that is solid and sound, you can minimize the risks and minimize the chance of complications.
One thing too is if I spent $200,000 on a car and a year later it broke down, I'm going to be right back to that dealership saying, what's going on? You sold me on, or I paid for the top of the line of them. I should have just bought the $84,000 one. Why not?
Yeah.
If this one didn't last. And kind of what we're trying to get at with this is that, if someone, you meet someone and they have a nice, beautiful smile and they got dental implants, it's kind of the same. You see both of these cars, and if someone doesn't know Porsche and the different trims, you're going to say, that's a beautiful Porsche. You're not going to know if they paid $200,000 or $100,000 for the car, which is literally double up the price. And it's kind of the same with dental implants. You don't know who placed them. It could look really nice, but you don't know how long they're going to last. You don't know the exact performance of everything. Sorry. And we're covering the same here with dental implants. Dr. Willardsen's about to show kind of good, better, best. Because, what do you think about those people that go to outside of the country, let's say Mexico, and they pay $15,000 for a full mouth reconstruction?
What do I think about it? It's, I see a lot of them. I would caution against that because, there's no recourse. There's no way to know what they're using, what materials they're using. And you really don't get too many shots at this. If I were to show, so moving on from the cars, kind of gives you an idea. There's a full spectrum of costs and fees. Every doctor is or every practice, whether it's one of the corporate centers, Clear Choice, Nuvia, or one of these places that are claiming to do it all in 24 hours. And that's the other thing. If you were to come into a car dealership and say, hey, I want this car and I want it done in 24 hours, and and they're advertising that they're going to build you a new Porsche Cayenne Turbo GT in 24 hours, me as a consumer, I know that's not possible. I know that there's something fishy going on there, right? And in reality, rebuilding somebody's mouth is very much like building a car from scratch. It feels very much the same. The time frame that it takes, it can take 3 months, it can take 6 months. It depends on the patient, what the bone density is, what the design of the case is, how much grafting is involved. There's so many variables, and to throw advertisements out there that you're going to do every single patient in 24 hours is false advertising. And so, all right, so let's take a look, moving on from that. And if you have questions, we've got a lot going here. We're trying to get to them. Mimi asks, would my records be helpful for my other doctor? Not necessarily. If you were to come in, I just start as if I'm the only guy that's ever seen you. I'll get my own records. I'll get my own impressions. I don't need even x-rays. I don't need any other x-rays from other doctors. I don't need impressions. I don't need anything from another doctor because I have my own way of doing things, and usually I wouldn't use it anyway. So, okay, so let's take a look.
There's so much involved in it that I did consider doing even out of the country just because of the cost factor. But I am so glad that I didn't, because there's so many steps involved
Notice
in it
on
along the
upper
way
jaw,
that
the sinuses
nobody's
are
really bringing
called
that out
advertised.
as far as when it
There's
comes
not
to
a lot of bone
advertising. That
back
I
in-
couldn't
in the
imagine have done it
area
anywhere
at the
else.
back.
And
Where
this
the
has been a
teeth
great
there's
place to
pretty
do it at.
decent bone.
It's
On the
been very
bottom, he's got
nurturing
good
and
bone everywhere, but
and
you see
very
this halo
considerate of my
around on the right-hand
needs
side
and as you can see, it's a
around
great
the
smile.
canine.
He did a fantastic
That's
job.
what I'm talking about
And
when I'm talking about extractions and having an infection at the tip of the root of a tooth that needs to be pulled. So if I were to pull that tooth out and leave that infectious tissue down there and then place an implant on top of that, or even just leave it there, graft it, and then go back in and place an implant on top of it, that's going to create a problem. So you have to know how to prepare. It's like you're a gardener, right? I mean, you don't want to leave weeds in your perfectly manicured garden that you're preparing to plant your cornfield in, right? And so same thing here. You want to make sure all the weeds, so quote unquote, are out and that the ridge is clean, the bone is clean, and then graft that area to make sure that you're building on a solid foundation. All right, so here is his pre-op or before x-ray, and then here is the after. So you'll notice we've got 6 implants, all very solid, very stable. The occlusion is back to the second molar. So he lost 14 teeth, and now he has 14 teeth. And so he's, we've created a scenario that's sound and solid for him. We don't have, I did cantilever on the upper, but it's a very small cantilever on both sides, considering if I did not have this last implant, so I've got 6 on the top, 6 on the bottom, you can imagine if I did only 4, which is what Clear Choice and these other centers are doing, I don't have a fraction of the support that I do in this case, where I've got solid implants in solid bone with a solid prosthesis. And then here we go. Here's his after photo, and you can see, aesthetically, of course, it looks great. But more important, and we just saw him this week as a follow-up, but more importantly is the functionality. When he talks about, because if you notice that upper picture and where he's missing the majority of his teeth, he could not really eat hardly anything at all. He was basically stuck to soft foods and his diet was compromised. But now, and he says this, in fact, we'll watch a video. He's like, it has changed my life. I am a new man. I am confident. I can eat. I don't feel this sense of doom and gloom because I've just lost my teeth. And at the time he was kind of losing, his life was in kind of disarray. But things are really starting to turn around for him. He's really starting to get, things. And I swear it has a lot to do with his confidence and his smile and his teeth. And so, and we'll show a quick video, kind of a testimonial.
There's so much involved in it that, that I did consider doing even out of the country just because of the cost factor. But I am so glad that I didn't, because there's so many steps involved in it along the way that, nobody's really bringing that out as far as when it comes to advertising, that I couldn't imagine have done it anywhere else. And this has been a great place to do it at. It's been very nurturing and very considerate of my, needs. And as you can see, it's a great smile. He did a fantastic job. And I'm living very, very happy.
It's fixed now.
Okay, so that kind of gives you an idea as to what to expect when you go through these, this process, and knowing, who to look for to do the case, doing your homework that way. When we talk about some of the patients who have come from other countries, or they've gone to, for example, this guy. Here's a case or a patient who went to Mexico, actually spent quite a bit of money in Mexico. This is a kind of a facial shot, so up front shot. Came back to me. So here is before. So he's before going to Mexico, or after he'd gone to Mexico, and now he's in my office and wants it all fixed. Got lots of bone loss around the majority of the implants, failing implants, prosthetics that are very, very poor. And so, here's just kind of an overall view. He spent lots of time, lots of money, lots of effort crossing the border multiple times, and then ends up not just a few years down the road having literally everything fail and fall out. So, and here is his after photo. Now he's done, he's complete. And, we were able to take out the implants that were failing and put in new implants and give him, restore his smile back to something that's going to be sound on a solid foundation, in good bone, and solid implants, and well thought out, designed prosthetics with really high quality, the best quality materials that we have to date. And so that's just one of many, many cases that we see where patients who have gone out of the country spent more. Yeah, it's a little bit cheaper. I think you might spend about half, but the risks are very high. Like I said, you get one chance. You get one chance of doing this. So, if you're going to get a deal or go to Mexico, maybe go, I don't know, get some taco sauce or something, or something that is not so risky, where if it's done wrong, the chances of fixing it go down. Whereas in bone, in our situation or in my practice, is critically important. So if I've lost it, regenerating it is very expensive. And so, let the doctors who know how to manage these cases manage them. And so that's just a good example of a case where he's gone to Mexico and now had to come here and do it all over again. So
when we see this quite a bit, I don't know what percentage of our patients are in this situation, but I don't know, what do you think, 30-40% of them are patients that already got it done somewhere else? It wasn't necessarily like out of the country, but could have been an implant center or just a doctor that, like you said, wanted to make some money and just place the implants. And we do this Monday through Friday, so we see consultations. From our YouTube or our social media presence, we get messages sent to us all the time from people who say the same thing. They're like, "Hey, I got it done with this doctor," or he did it halfway, or they couldn't finish it, and they have to fly all the way over here. So it's definitely something that most people consider. Everyone wants to pay the least amount of money for the most value. Everyone wants to do that. I want to do that too. But what you really have to understand, kind of like what Dr. Willardsen said, is that you really get what you pay for, as far as like quality. And that's why we showed the example of the Porsche, how the price can vary so much. It can go from $200,000 all the way down to $70,000 for almost the same car that can take you from point A to point B. But it's also the quality of the material, is kind of the time that it took to like really build it. I feel like those higher end cars, they're really build more in detail, and they have like specific.
Yeah, there's a reason they're more expensive.
Yeah,
it's okay. So we're running out of time here. We did
and
start a little late,
you
so
find
we'll go
Dr.
into about
Willardsen,
10:05.
You did
One more
some
case,
implant
and this one I want to show
Yeah.
you.
with other doctor?
Yes.
Again,
But you're not-
That doctor is not a specialist.
and I want to show
Cost me a lot
what it looks
also.
like in the mouth.
It cost me $60,000 to do the.
And you'll see on these images, why it's important, one, to have the work done correctly, 2, to use good quality materials, and 3, the negative effects of if you do have it done in another country or by a doctor who's not trained, which could be even here in the U.S., it just creates a real headache and a situation where the patient has to go through it all again, and they thought they were doing it right the first time. So if you'll notice on this x-ray here, I've got lots of implants. He spent a lot of time, a lot of money, a lot of effort. Implants failing in the upper, what is the patient's left, but on the screen it's the right side. The majority of these are failing. So I had to remove quite a few implants. Now let's look at what it looks like after I've removed the prosthetic from the mouth. And so here it is in the mouth. And notice around each implant. First of all, when I look at these implants, there's corrosion. There's corrosion down inside the implant. And what does that tell me? One, obviously, it's not a commercially pure titanium implant. It's an alloy of an implant. And so when you have an alloy, and I've mentioned this many times, there's a mixture of metals. And so it's those trace metals, not the titanium, that cause corrosion, rust, just this dark look around each of these implants. And so these are cheap implants. This implant costs the dentist about maybe less than $100. So that's why when you go to Mexico, they're able to do it at a fraction of the price. The implants that I buy, Noble Biocare, Thai Ultra or Actives, about $520 per implant. So it's the machining, it's the surface area of the implant and how it integrates into the bone. All of these are critically important factors. So you can see, you don't have to be a doctor to see this infection and that white plaque pus around the majority of these implants. And then here's a photo at surgery. So I've got all these threads exposed. So the implant is buried. In fact, these are like 10 millimeter implants, and I have about 6 millimeters of 6 millimeters of implant that is protruding out of the bone. So I have about 4 millimeters of implant that's still attached to the bone. So one, they used a very short implant that, there's no point in putting a 10 millimeter implant in an upper jaw when I've got 15 millimeters of bone. So a lot of these things lead to the fact that they did not know what they were doing. They were just throwing implant. And plus the random positioning. There's no plan. They're just kind of random here and there, haphazard placement of these implants. And so that, along with the bone loss, along with the type of materials that were used, and also the fact that the case is completely failing, is indication that this was done by a rookie, done in Mexico. So they don't have any ramifications of, if something goes wrong, what's the guy going to do? There's no way to resolve that. He's certainly not going to get his money back. And so here's just a picture of after. And also the diameter. So this is a 3.5 millimeter diameter. The only time I use a 3.5 is if it's in a very tight position, like a lateral position or a lower central or lateral incisor. I don't use 3.5s really ever. It's always a 4.3, a 5.0. The most would be a 5.5. But, just looking at implant diameters also tells me the abilities of the doctor. Using a 3.5 in a position that should be at least a 4.3 or a 5.0, meaning 4.3 millimeters in diameter or a 5.0 millimeters in diameter. So lots of issues with this case. We had to do a tie mesh onlay graft. I'll show you the x-ray. So to do a $30,000 bone graft, because I have to regenerate all this bone that was lost when we extracted these implants, we lost some bone, and also because of the infection around the implants, we lost a lot of bone. So I have to regenerate all that bone. graft the sinuses. You know, it's kind of like I've gone even further backwards because I'm having to fix and rebuild and recreate all that had been lost because of the choice that the patient made to go to Mexico. And that's why I caution, you know, do it right, do it once the first time, and you know, you may spend a little bit more money, but in the end, it's going to be so much worth it because you won't have lost so much. You know, this guy's going to he's going to pay twice for this case. So, but anyways, these are all really good cases that can demonstrate a lot of the issues and questions that we have on YouTube on our channel. Patients will ask questions. And the best way for me to describe and explain these things is through photos and video and scenarios. I think it's helpful. I think that it makes it so, you know, somebody who's in this case or in this situation that needs to have this work done, it can help them build a case to where they can get it done properly, pay once, and just, it is truly transformative procedure, but it's got to be done in the right hands. So anyways, thank you guys for watching. It's always a pleasure to talk about this. As you can tell, I can ramble on for days and days about it. I should probably get a hobby, but for now, this is what I'm doing. So I'm Dr. Willardsen here with Memo Hea, and thank you all for watching today on our live stream. And visit us at Trust Implants, subscribe, hit that like button. Go to our website, trustimplants.com, our social media channels on Instagram, Facebook, as well as, of course, on YouTube. Follow us on YouTube. We've got a lot more content, a lot more videos. If you're in a situation where you're needing this work, we can definitely help you. And doctors who are needing help in the process of establishing and building implant centers and knowing how to do it properly, also there for you guys as well. Thank you. I'm Dr. Willardsen, and thanks for watching.